So now, why is it that very many deaf people cannot protect themselves from HIV/AIDS? Why? You know this, surely, way back, the statistics that we have show that AIDS, way back, about 50 years back, 5 years back, it was 7.8%. The rate was 7.8%, and it reduced to 5.8%. It reduced, but now that is a general perspective, a general view about the HIV/AIDS statistics. So now we are putting the general view aside, and the question is on the disabled community. We do not know where the statistics are. So we are zeroing down to the disabled community, and now specifically the deaf people. You know that deaf people is a specified disability. You know that deaf people have a challenge united with communication. For the blind, it's easy to communicate. They do not see well, but they can hear. And those who are vulnerable, to say those ones can also access information. They can easily access that information. But the deaf community, they have a challenge with that communication. They cannot access that communication. It's very hard. You know, like on the televisions, radios, they cannot access information. The deafs do not hear the information on radios. So most information about HIV/AIDS sensitization is on radios. Mostly they broadcast it on radios, and the deafs can never get that information. They do not benefit from it. So the deaf people get information about HIV/AIDS on TVs, maybe posters, adverts, but truly very many deafs do not know how to read. They don't know how to read. It's challenging. So accessing information is very hard to them. Then thirdly, at the hospital, you can also access information. Communication from there is also at a small extent for them to access services at the hospitals. You know, there are few people who know sign language at the health facilities. For example, I can sign well, and also you sign well, and this is a deaf person, like you meet a doctor and the person is like, this is a deaf person, how do I communicate with that person? And the line is very long, so he decides to put you aside. You're a deaf person, they put you aside, a medical assistant, and someone also comes. So there is also a challenge at the hospital, accessing of services at the health centers. The nurses who know sign language, also some of them have a negative perception towards the deaf community. So it also depends on the heart of the person. If they see a deaf person signing, if they really desire to help you out, they can talk to you. So if you're a deaf person, if you come and it's your first time to come to the hospital, you really desire to come, but the environment is negative onto you, you should not be crazy like signs that, you should not be disappointed. You should calm down. Most of them, you should come back the second time, or if a deaf person comes, you should advocate and write. You should try maybe health issues. You know, health issues are private. Like, I am a deaf person and I write well. So you're the doctor, you write, you give me. But it's so challenging, like writing, you say, please, I want HIV/AIDS services. You give a doctor, so the doctor pulls down the specs and reads. Then he calls this person. So, and he's like, oh, you need HIV/AIDS services. And he says, okay, come. They take you to the right person. So when they put you to the right facility, maybe the person is like, Bambi, you're negative. So you have an interpreter. You know, interpreters are many who are there. Me, I've never seen interpreters in the hospital. I've never seen any interpreter in the hospital. There are 0 interpreters in the hospital. So now, when a deaf person comes to the hospital, how do you communicate? there is, remember that deaf is a minority community. It's a minority community. So now you can, since you're a minority community, what happens in this community? You very well know the word sexual network. Why? Because it's a special, it's a minority group. We are signing, and you know we use sign language, and this is what happens in our group. We've left out the other group, meaning the sexual network, we are rotating around ourselves. So that's what I've told you as sexual network, sex network. So we are evolving around the community, the minority community. So these are the ones who multiply the AIDS in the community.